You know that nagging worry when your dog has a swelling that just uh, doesn't seem right?
Mm.
Maybe it's draining a little and you're thinking, well, this feels like more than just a run-of-the-mill infection.
Exactly. And today we're diving deep into something specific called Actinomycosis A. It's a bacterial disease affecting animals.
Right, Actinomycosis A. We hear about it, but maybe don't know the details, especially for dogs, right?
Mostly dogs, yes. And we've got some detailed info here. It's definitely not something to just brush off. Understanding what it is, who gets it, the signs.
How you diagnose it, how you treat it, all crucial stuff.
Absolutely.
Okay, so our source material today is the pasted text. We've gone through it to pull out, the need-to-know
Just
information.
trying to make it accessible, cutting through some of the really technical bits.
Exactly. Our goal, our mission, if you like, is just to arm you with practical knowledge. So if, heaven forbid, your pet shows these signs, you're a bit more prepared for that vet conversation.
Makes sense.
Okay, so let's get to the heart of it. What exactly is actinomycosis A?
Well, basically, it's an infection. It's caused by a certain group of bacteria called Actinomyces.
Okay.
They're described as gram-positive branching pleomorphic rods. That's just how they look microscopically.
Helps identify them, I guess.
It does, and we often find specific species like A. viscosus or A. hodiovolneris. But interestingly, a lot of the time, they don't actually pinpoint the exact species.
So it's like a family of bacteria, but maybe not always identified down to the individual member.
Pretty much. And here's a really key thing. These bacteria, they like low oxygen conditions, microaerophilic or anaerobic.
Right, not much air.
Exactly. And
Okay.
maybe even more importantly, actinomyces, it rarely works alone. It's usually part of a polymicrobial infection.
So other bacteria are involved too, like a team effort.
It suggests that, yeah, maybe they help each other out. And this infection, it's not picky. It can hit the skin, respiratory system, cardiovascular,
Well, yeah.
musculoskeletal, even the nervous system.
That's a huge range.
Wow.
So which animals are most likely to run into this?
The data points pretty clearly to dogs. It can happen in cats, but it's much less common.
Okay, dogs primarily. Any specific kinds of dogs?
Yeah, it seems young male dogs, especially sporting breeds, are the most susceptible group.
Huh. Young male sporting breeds.
Yeah.
Any idea why them specifically?
Well, it's not totally clear, but maybe something to do with their activity, more chances for, little injuries, scrapes, exposure to things in the environment.
That makes sense. Okay, so that's the who. Now the what signs should people be watching for?
Okay, so usually it starts localized, though it can spread. A really common spot is the head and neck area.
Cervicofacial.
That's the term, yeah. Look for swellings there or abscesses, especially if they have draining tracts, little openings where pus comes out.
Okay.
And here's a big one. Visually, check that discharge, the pus. If you see tiny yellow flecks, almost like grains of sand,
Yeah.
those are called sulfur granules, very characteristic of actinomyces.
Sulfur granules, got it. That's a key visual. What about signs that aren't so obvious on the surface? Internal stuff.
Right. Systemically, the pet might just seem off, maybe pain you can't pinpoint, a fever, weight loss.
General signs of being unwell.
Exactly. If it hits the respiratory system, you can get fluid buildup, either in the chest cavity, that's pleural effusion, or in the abdomen, peritoneal effusion. Less often around the heart, pericardial effusion.
And that fluid in the chest, that would cause breathing problems.
Definitely. Coughing, difficulty breathing, maybe decreased lung sounds if the vet listens, especially down low. That's called empyema if it's pus.
You also mentioned it could affect their back.
Yeah, if the infection sets up behind the abdominal organs, retroperitonitis, it can cause pain in the lower back. Sometimes even weakness or paralysis in the back legs from pressure on nerves.
Wow. And bones, too.
Osteomyelitis, usually that happens when a skin infection nearby just spreads deeper, often affects the vertebrae, the spine, or the long bones in the leg.
Leading to lameness or swelling there.
Exactly. And rarely you can get neurological problems if these inflammatory lumps, granulomas, press on the spinal cord.
So it can really manifest in a lot of different serious ways. What about cats? Since it's less common, do they show different signs?
Yeah, for cats, the most typical things we see are pyothorax, that's the pus in the chest cavity.
Making breathing hard.
Right. And also subcutaneous abscesses, often from bite wounds. So still serious, but maybe a slightly different pattern than in dogs.
Okay, that gives us a good picture of the signs.
Yeah.
But how does this even start? You said the bacteria are normally in the mouth.
That's the really interesting part. Yes, actinomyces are normal residents of the mouth in dogs and cats.
So they're usually harmless.
Usually, the infection typically kicks off when something disrupts the body's normal defenses, like damage to the skin or the lining of the mouth.
An injury.
An injury, yeah, or maybe the animal's immune system is weakened for some reason, or even just a shift in the other bacteria living there. It's often seen as opportunistic.
Ah, so it needs an end. It takes advantage of a situation.
Precisely. And we know some specific things that increase the risk. Trauma is a big one, especially bite wounds.
Because that directly puts mouth bacteria deep into tissue.
Exactly. Also, migrating foreign bodies. Think grassons, or specifically foxtails out west. They can burrow in and carry bacteria with them.
Nasty things, those foxtails.
They really are. And even something like periodontal disease, gum disease, can potentially create an entry point.
Okay, so let's say the signs are there, the risk factors fit.
Yeah.
How does a vet actually confirm it's actinomycosis A? Sounds like it could look like other things.
You hit the nail on the head. Diagnosis can be tricky. The main thing it gets confused with is nocardiosis.
Another bacterial infection.
Right, and they can look really similar, both clinically and sometimes even initially under the microscope. Plus, you have to rule out other reasons for chronic draining wounds or fluid buildup.
So it's not immediately obvious. Do blood tests help much?
Blood work, CBC, chemistry panel, urinalysis usually just shows general inflammation or infection signs. Not specific,
Yeah.
right? You might see things like a high white blood cell count, maybe a specific type called monocytosis, sometimes anemia, low blood sugar, high globulins, but none of those scream actinomycosis.
Okay. What about imaging, like x-rays?
Imaging is definitely helpful. Bone x-rays might show changes like new bone forming on the surface, maybe some bone destruction, or areas that look denser.
Okay.
Chest x-rays could show lung pattern changes, fluid, maybe even masses. Abdominal x-rays might show fluid or mass effect pushing organs around.
And if the spine's involved?
X-rays there might show new bone, especially in the lower back, say T13 to L3 area.
So imaging gives clues, points you in the right direction, but doesn't definitively say actinomyces.
Exactly. For a definitive diagnosis, you really need to identify the bacteria itself.
How do you do that?
You need to get a sample, pus, maybe a bit of tissue or bone from the affected area. And this is crucial. It needs to go to the lab in an anaerobic container.
Because of the low oxygen thing.
Right, and you have to tell the lab you suspect actinomyces. It's also smart to send a separate sample for regular aerobic culture, too, to see what other bacteria might be in that mix.
Okay. What about looking at the sample directly? Staining it?
You can do that. Fresh smears, gram stain, cytology, acid-fast stain. Now, actinomyces isn't acid-fast, which helps distinguish it from some nocardia species, but not all. Staining gives hints, but it doesn't replace culture. Culture is king here.
And examining the tissue itself.
Biops.
Histopathology, yes. Looking at thin slices of the tissue is really important, but finding those sulfur granules can be hit or miss in a small sample, so they might need to look at multiple sections.
I see.
Special stains can help make the bacteria easier to see. Typically, you find this chronic inflammation pattern, pyogranulomatous cellulitis, with colonies of the filamentous bacteria tangled in there.
Okay, so diagnosis confirmed. Now treatment, what's the approach?
Well, first step, like we said, is making sure it is actinomyces and not nocardia, because the antibiotic choice really differs.
For actino, treatment needs to be long. We're talking minimum 3 to 4 months of antibiotics, and that's after all the signs are gone.
Wow, that's a long time.
It really is. And remember that polymicrobial thing. You might need an antibiotic that covers the other bugs, too.
So what's the go-to antibiotic for the actinomyces itself?
Penicillins are usually the first choice. Often, giving it by mouth is enough, like amoxicillin, maybe 20, 22 milligrams per kilogram every 8 hours.
Are there antibiotics that definitely don't work, ones to avoid?
Yes, metronidazole generally isn't effective against actinomyces. Aminoglycosides also aren't good choices for anaerobic type infections like this.
Good to know. What about that specific type, A. hordeovulnerus? You said it might resist penicillin.
That's right. It's a bit different, maybe lacks a proper cell wall. So if that's suspected or confirmed, drugs like clindamycin, erythromycin, or chloramphenicol might be needed instead.
So mostly antibiotics, but is there anything else involved in treatment?
Oh, definitely. If you have those big fluid collections in the chest, abdomen, under the skin drainage is vital. You need to get that inflammatory stuff out. Lavage, flushing the area, also helps.
Okay.
For cats with pyothorax, a chest tube with continuous suction is often the way to go. For dogs with pyothorax, interestingly, They often recommend surgery first
Surgery, why?
to look for and hopefully remove a foreign body, like that grass-on we talked about. It's a common cause in dogs.
Get the source of the problem out.
Exactly. And sometimes if there's like a really diseased lung lobe or a distinct mass, surgical removal of that specific part might even be curative.
So it can be quite involved, long antibiotics, drainage, maybe even surgery. What happens after treatment finally finishes?
You've got to watch them closely. Monitor for any signs of recurrence, especially in the first few months after stopping antibiotics.
Makes sense. Can pet owners do anything to try and prevent this in the first place?
Well, complete prevention is tough, but avoiding areas with lots of grass-ons, especially during foxtail season, can help. And preventing bite wounds is another big one, though obviously hard to guarantee. Good dental hygiene might also play a small role, just reducing the overall bacterial load in the mouth.
Are there things that make treatment harder? Complications.
Yes, definitely. If the pet has another condition that suppresses their immune system, or if they're on medications that do that, like steroids,
Right.
that makes fighting off any infection, including Actinomycosis A, much more challenging.
So for owners facing this, what's the general outlook? Prognosis.
It's guarded in some ways. Unfortunately, even with apparently successful treatment, reinfection at the same site happens in maybe up to half the cases.
Wow, 50%. That's high.
It is. It really highlights why that long treatment and careful follow-up are so important.
Okay, let's try and bring it all together then. This deep dive shows actinomycosis A is, well, it's pretty complex. It's this bacterial infection often sneaking in when defenses are down.
And those sulfur granules are a really key clue if you see them.
Right. And the treatment isn't quick, needs early detection, the right diagnosis, distinguishing it from nocardia,
Ah,
and then that long targeted antibiotic course, sometimes with drainage or surgery too.
absolutely critical.
And hopefully, understanding all these bits and pieces helps you, the listener, feel more empowered.
Yeah, so you can have those productive talks with your vet if you ever suspect this might be going on with your pet. You know what questions to ask, what the possibilities are.
Exactly. You're part of the team.
Which brings us to a final thought. You mentioned Actinomyces lives normally in the mouth.
Yeah, it's part of the normal oral flora.
So it makes you wonder, doesn't it, what other health issues, maybe ones that seem totally unrelated, could be influenced by the delicate balance of bacteria in our pets' mouths?
That's a fascinating question. The oral microbiome,
Yeah,
it's a whole world in there, and we're still learning how much it affects overall health.
something to think about. Well, thanks so much for joining us on this deep dive today.
My pleasure.